venous anastomosis, and all of these diagrams, here it is small mistake. This is intervertebral vein should attach to posterior intercostal. Attach here and here and here. This is better. All of these diagrams and fetal circulation, and this diagram also. Next time, give you written test. This is what? Superior vena cava. And here, inferior vena cava, common iliac. They are vena lumbalis. It is vena lumbalis ascendens. This is azygous vein, hemiazygous. That is easiest anastomosis between vena lumbalis, which comes to inferior vena cava, and vena lumbalis ascendens, which continues into hemiazygous and azygous and goes to superior vena cava. Caval anastomosis on posterior abdominal wall. And we continue to draw at this diagram. This is brachiocephalic vein, then internal jugular, subclavian. This is vena vertebralis. Vertebral vein opens into brachiocephalic vein, vena vertebralis. Here, accessory hemiazygous. What is it? Posterior intercostal veins, and now venous plexus in the region of vertebral column. We have internal vertebral plexus inside of vertebral canal and outside external vertebral plexus. This is plexus vertebralis in the region of vertebral column. And from vertebral plexus, vena intervertebralis in cervical department goes to vertebral vein. In thoracic department, vena intervertebralis opens into what? Into posterior intercostal vein. And in lumbar department, vena intervertebralis goes to vena lumbalis. And we receive anastomosis between superior and inferior vena cava in the region of vertebral plexus. Clear? We put labels. Number one, intervertebral veins everywhere. Vena intervertebralis. Clear? Number two, vena vertebralis. Number three, vena brachiocephalica. 4, superior vena cava. 5, posterior intercostal veins. Then 6, azygous vein. 7, hemiazygous. 8, accessory hemiazygous vein. Then 9, vena lumbalis. It's possible to put 10, vena lumbalis ascendens, and 11, vena cava inferior. Next diagram. Superior vena cava, brachiocephalic, internal jugular, subclavian, and axillary. It is axillary. Then inferior vena cava, common iliac, internal, external iliac, and femoral vein. On anterior abdominal wall, we have venous plexus, and blood from this venous plexus goes upward through superior epigastric vein. It continues into what? Internal thoracic vein, and internal thoracic opens into brachiocephalic. Then thoracoepigastric vein continues into vena thoracica lateralis, and lateral thoracic opens into axillary vein. Vena epigastrica inferior goes to external iliac, and vena epigastrica superficialis goes to femoral vein. And now we have anastomosis between veins which goes to system of superior and inferior. Caval anastomosis. Caval. It is this diagram. But if we add to this diagram portal vein. Look here. This is liver. Here it is portal vein. Portal vein. And from this venous plexus, vena para, what? Umbilicalis, goes to portal vein. And we receive porta cava caval anastomosis on anterior abdominal wall. Clear? You put labels. Number 1, superior vena cava. 2, brachiocephalic. 3, internal jugular. 4, subclavian. 5, axillary. 6, superior epigastric. 7, internal thoracic. 8, thoracoepigastric vein. 9, lateral thoracic vein. Then 10, inferior vena cava. 11, common iliac. 12, internal iliac. 13, external iliac. 14, femoral vein. 15, inferior epigastric. 16, superficial epigastric. 17, para umbilical. And 18, portal vein. Porta cava caval anastomosis on anterior abdominal wall. Next, this diagram. Look here. This is superior vena cava. This is stomach. And here it is esophagus. Liver, portal vein, and you already know that from stomach, which vein goes?
Gastric vein.
Yes, gastric. What is it right or left gastric?
Left.
It is left gastric, and left gastric vein is the same. Receive blood from abdominal part of esophagus. Another veins from esophagus, vena esophagealis, opens into what?
Azicus.
Well, hemiazygous is the same, but in my diagram only azygous vein. This is porta, that is from esophagus, blood, one way for blood into azygous vein and superior vena cava, or left gastric vein and portal vein. Clear? That is porta caval anastomosis in the region of esophagus. Clear? We put labels. 1, superior vena cava. 2, azygous. 3, esophageal veins. 4, left gastric. And 5, portal vein. Then, this is this diagram. Inferior vena cava, vena cava inferior, common iliac, internal iliac, external iliac, and internal iliac vein, it receive internal pudendal vein here, internal pudendal vein. Oh, this is the same, internal iliac and internal pudendal vein. Here it is a rectum, that is rectum, canalis, and from upper part of rectum, vena rectalis superior goes to inferior, what? Mesenteric vein. Vena rectalis media opens into internal iliac, and vena rectalis inferior opens into internal pudendal. If it is number 5, 6 that is inferior mesenteric, 7 superior rectal, 8 middle rectal, 9 inferior rectal, 10 internal pudendal, 11 internal iliac, external iliac, common iliac, and inferior vena cava. And we receive porta caval anastomosis in the region of rectum. Clear? Next, this diagram. That is, it is liver, portal vein. This is inferior vena cava, common iliac, vena lumbalis, and here it is ascendens colon, and here descendens colon. Blood from ascendens colon through vena gastrica dextra goes to vena mesenterica, what? Superior. From descendants colon, vena colica sinistra goes to vena mesenterica inferior, and blood from posterior side of ascendants and descendants colon, it can flow into inferior vena cava through vena lumbalis. We receive porta caval anastomosis in the region of ascendants and descendants colon. Here it is. Number 1, vena gastrica dextra. 2, vena mesenterica superior. Number 3, vena colica sinistra and vena mesenterica inferior. Oh, splenic vein and portal vein. Number 7, they are vena lumbalis, and 8, vena cava inferior. And give me one page else. Circulation, fetal circulation. This is placenta. And here it is. From placenta, umbilical vein conduct oxygenated blood, put here oxygen, oxygenated blood to fetus. Here it is liver of the fetus, portal vein, and umbilical, that is portal vein, and umbilical vein opens into portal vein. And umbilical vein gives ductus venosus, and ductus venosus goes to inferior vena cava. Here it is vena cava inferior vena cava. In inferior vena cava, deoxygenated blood, and oxygenated blood from umbilical vein goes to portal vein, and through ductus venosus goes to inferior vena cava, and here blood mixed. And this mixed blood passes through inferior vena cava, receive deoxygenated blood from hepatic veins and mixed one again, and comes to which chamber of the heart?
Right atrium.
Yes, it goes to the right atrium. Comes to right atrium, and from right atrium, here it is, we have what? Foramen ovale. And this mixed blood passes through foramen ovale into left atrium. From left atrium goes to left ventricle. And what starts from left ventricle? Aorta. This is aorta. And goes to aorta, that is brachiocephalic, left subclavian, left common carotid, and left subclavian artery. Then, here it is superior vena cava, and blood from superior vena cava goes to right atrium, then goes to right ventricle, and what starts from right ventricle? Pulmonary trunk, and pulmonary trunk subdivides into right and left pulmonary arteries, but fetus not participate in breathing, and blood which passes through lungs, it is not necessary to passes for blood through lungs. That is why most part of this deoxygenated blood from pulmonary trunk goes to aorta through ductus arteriosus, and this duct opens into aorta below of left subclavian artery, and blood mixed one again. And this blood goes to aorta. That is why head and upper extremity receive blood which is richer with the oxygen than trunk and lower extremity. Clear? Because a large portion of deoxygenated blood comes to aorta below of left subclavian artery. And then this blood goes to all inner organs, in thoracic cavity, in abdominal cavity, in pelvis, in lower extremity, and from internal iliac artery, from internal iliac artery, we have arteria, what is this artery? Arteria umbilicalis, umbilical artery, which goes to umbilical cord and goes to placenta. That is arteria umbilicalis. What happened after the birth? We cut umbilical cord and umbilical vein, it closed and makes round ligament of the liver, ligamentum teres hepatis. Do you remember on visceral surface?
Yes.
This venous duct, the same, closed and makes venous ligament, the same on the liver, on visceral surface, ligamentum venosum. Foramen ovale, it closed and makes fossa ovalis. Ductus arteriosus also closed and makes ligament, ligamentum arteriosum. And umbilical arteries, they also close and makes middle umbilical ligament, ligamentum umbilicalis medialis. Only in the beginning, umbilical artery gives arteria vesicalis, and all another distance, umbilical artery makes middle umbilical ligament. Clear it is? We put labels. Number 1, that is umbilical vein. 2, portal vein. 3, ductus venosus. 4, inferior vena cava. 5, hepatic veins. 6, superior vena cava. 7, foramen ovale. 8, aorta. 9, pulmonary trunk. 10, ductus arteriosus. 11, that is common iliac artery. 12, external iliac. 13, internal iliac. And number 14, that is umbilical artery. Oh, if you want, 15, that is placenta. Well, all of these diagrams, next time you should prepare. I give you written test. And the same diagrams will in our final lesson on venous and lymphatic system. Okay.
The umbilical ligaments.
Umbilical ring, that is anterior abdominal wall, and we have plica umbilicalis medialis, plica umbilicalis mediana, and plica umbilicalis lateralis. This median umbilical ligament and fold in place where urachus, that is from urinary bladder, and this medial umbilical fold and medial umbilical ligament in place where was umbilical artery. It goes to umbilical cord, and in fetus, umbilical cord goes to placenta and so on.